Meghalaya reported a fresh case of COVID-19 after a gap of almost 19 days on May 9, 2020. The patient was reported working in the same house as that of the index patient. The latest positive case was found after the health department was retesting all the primary contacts of the index case. The patient is said to be safe and healthy and showing no symptoms. Chief Minister Conrad K Sangma, speaking on the development, said as a precaution, Health Department was retesting all the primary contacts and in the process found the positive case.
Out of this 181 tests, one has come out to be positive, and this happens to be a person who was working in the house itself, one of the maids who was working in the house itself.
The last COVID-19 positive case in Meghalaya was reported on April 20. The patient is a close friend of the family of the index case. After another mate of the senior doctor who recently died of COVID-19 had tested positive, Meghalaya Chief Minister Conrad K Sangma had ruled out the possibilities of retesting the 10 COVID-19 patients who had been declared fully cured. Sangma said, when asked if the government is thinking of doing a retest, taking the peculiar nature of the virus into consideration, Sangma said,
protocols as per requirement. In fact, in this particular case, protocols didn't require it, but we still went ahead with 181 retest. Yes, and as I said, the new test that we are conducting now is much more accurate and much more sensitive, and therefore, it's good that this kind of initiatives were taken by the health department.
He further stated that the new tests which were done on the 10 recovered patients were accurate. To a question if the government is looking for a mass testing in view of the increase in the capacity of the testing facilities in the state, he said that it is not just about having testing centers, but having a testing kit is also a challenge.
It's not just having testing centers, but testing kits also are a challenge. So therefore, it may not be possible for us to do that, but that does not mean that we will not take immediate steps whenever required. So as per requirement, we need to ensure that it's utilized in a very proper manner. But we have the option, of course, going for the rapid tests which are there. But of course, there are questions regarding its accuracy. So therefore, as of now, we have not decided on any kind of mass testing. As per requirement, as per necessity, we will take a test. Okay.
Sangma, however, said that at the moment, the government is concentrating on the high-risk primary contacts. On the new COVID-19 case detected in the state, he informed that she was among the 181 high-risk primary contacts which the government had identified.
Which we call high-risk contacts. They were tested again, 181 of them. And out of this 181, one has come out positive. The reason we have conducted this, even though the protocols don't require us to necessarily do it, is because we felt it would be much more safer to ensure that we do this test again. In fact, the person was tested on the 16th, in the first, and then that time the person came out negative. The person and the whole family, her whole family, was quarantined, remained to stay quarantined for 14 days, which they did. And even now, till now, they are under quarantine.
After the woman was tested positive following a retest, the Meghalaya Chief Minister said that her husband and 2 children who are the primary contacts have all tested negative. While the Meghalaya government on Saturday decided to make some major relaxations for all the districts in the state amid the COVID-19 lockdown, Deputy Chief Minister Preston Tenson informed that the government has now decided to allow all types of shops across all districts, excluding Shillong and its adjoining areas which are under the green zone, to be open from Monday. With the latest case, the total tally in Meghalaya had gone up to 13, including 1 death. 10 of them have so far recovered. Bureau Report.